I've spent the last few years working for one of the largest Shockwave clinics in North America, and I've learned a thing or two about the power and untapped potential of regenerative medicine. But the march towards a future where sickness is healed from its root cause is challenged by the influence of big pharma and their deep pockets. So now we're forced to answer questions like, how do we get rid of joint pain, take back our performance in the bedroom, and heal diseases from the inside out without band-aid medications or negative side effects? This show will give you the answers. Follow along as I interview the world's top experts and doctors and how they transformed their lives and their patients' lives using the newest advances in biotechnology. I'm your host, Austin James Wolff, and you're listening to Modern Biotech Radio. Hey, what's going on, modern biotech lovers? Okay, so today I'm talking about shockwave therapy for stronger erections and who it won't work for. So this is episode 4 of a 5-part series. The previous episodes I talked about the origin of shockwave therapy, where it came from, how it works for improving sexual performance, the physics behind it, and how it actually does work if you're super healthy. But if you're not completely healthy, if you don't take care of yourself that well, there are some other red flags or black flags that are causing your erectile dysfunction, that even if you use shockwave therapy to improve the physics and the blood flow behind your penis, there might be some other factors affecting erectile dysfunction. So today I'm talking about that. Just to give you a little backstory, we run the largest shockwave clinic for sexual performance in North America. We do more treatments than anyone else out there for a single clinic. So even more than the big brand name that you might be thinking of. So when we started doing this, we noticed a lot of men were getting really great results, but then a certain amount of men weren't getting great results. And we looked into it to find out why. And all the men that weren't getting as good results had something in common that the awesome group that got great results didn't seem to have. And so what we started to do was we started to classify red flags versus black flags. And after classifying these, after we identified who this wouldn't work for, our success rate jumped through the roof. We now have a 90% success rate with people coming in with erection problems. And the other 10% who this doesn't work for are people that have these red flags and either didn't tell us or told us they would work on them, but didn't. Okay, so the people that didn't have the red flags, didn't have the black flags, this worked for them. Hands 100%. If they didn't have the red flags or the black flags, this worked for them. We have not had a patient who this didn't work for that didn't have these red flags or black flags and followed our recommendations. So if you don't have these flags, you follow our recommendations, 100% success rate that we've had so far, right? But if you have these red flags, if you have these black flags, you need to work on these things first, or in addition to getting your shockwave therapy treatment. So what are these black flags and red flags, you might ask? Let's jump into it. So we started to identify it, and these are the sort of questions that we ask patients during their consultation. So these are the red flags. These are the things that you can still have success with shockwave therapy, but if you take care of these red flags as well, you're going to have even more success, right? So, and then if you have a combination of these red flags, the more combinations of red flags you have, the less your success rate is going to be unless you take care of them, right? So again, keep that in mind. If you have just one, there's a lot of hope, right? If you have a combination of it, you have like 3 or more, that's really bad, okay? So let's just jump into it. So the red flags, these are the things that you should take care of. So diabetes is one, high blood pressure, obesity. Okay, now what we say one of our black flags is a combination of all 3. If you have diabetes, high blood pressure, and obesity, you need to take care of that first, okay? We turn patients away who have all 3 of those because they're going to do this treatment. We're going to fix the inside of their penis. We're going to fix the piping, the plumbing of the penis, but they're going to have all these other things that are affecting their erectile dysfunction, and they're not going to solve the root cause of their ED, which is the combination of obesity, diabetes, and high blood pressure, which is affecting their blood flow, right? So if they take care of that first, let's say they get shockwave treatment done, we fix the plumbing in their penis, and they still have these 3 things, they're probably not going to see results. But the plumbing is fixed down there. So as they start improving upon these 3 things, the diabetes, the high blood pressure, and the obesity, as they start losing weight, as they get their diabetes under control, as they get their blood pressure under control, as they start to remove those red flags, then they're going to start seeing erections again, because we've already dealt with the number 1 root cause of ED, which is a lack of blood flow, the microplaque in the penis. Remember? That was episode 3. Let's keep going with the red flags. We have diabetes, high blood pressure, obesity. If you drink alcohol every day, the 10% that I mentioned that don't see success, don't really see success, they drink alcohol every day. That was another thing we found. Drinking alcohol once a week, maybe twice a week is fine, but if you drink alcohol every day, I'm sorry, you got to stop that, okay? Number 5, smoke cigarettes every day. We've had success with men who did smoke cigarettes but didn't have any of the other red flags, meaning they weren't overweight, they didn't have diabetes, they didn't have high blood pressure, they didn't have all the other stuff that I'm about to go through, and they just smoked, they saw results, right? but you really should stop smoking if you want to have a healthy sex life and have healthy erections, okay? I might even call that a black flag. Poor diet, that was another red flag. Now, again, you can have 1 or 2 of these red flags, and this can still work for you. But the more red flags you have, the more of a chance it's not going to work for you, right? Because there's other things. Again, ED is not just a one problem fix all, one solution fix all approach. It's a multi-pronged problem. There might be other factors contributing to your ED. Shockwave therapy deals with the number one root cause of it, but there might be all bunch of other, different, similar, different causes that cause your ED. Does that make sense, guys? I know I'm going on a tangent. Let's keep going. If you take a lot of painkillers, this one's important because painkillers decrease inflammation, but when we're using shockwave therapy in the penis, we're creating micro-inflammation. That is what causes it to grow, right? It's like remember the bench press analogy I used in the last episode? It's like using shockwave therapy for your penis is like it's like doing bench press, right? What you're doing is you're creating microinflammation in the penis, but on bench press, you're creating those tears in the muscle fiber. That's what causes the body to send blood flow to that area and make it grow, right? Same thing with the penis and shockwave therapy. You're creating microinflammation, which causes a response in the body to send blood flow there and make the nerves stronger, make the blood vessels stronger, and grow new blood vessels. That's why men who get shockwave therapy, who are completely healthy, still end up getting even better erections than they've ever had in their life before, because they're growing new blood vessels. It's like you take a guy that's runs a lot but has never done bench press before, and he starts doing bench press. Well, what happens? His chest gets bigger, right? So that's kind of the same thing. Another red flag. So just to wrap up that point, if you take a lot of painkillers, you're going to want to stop for 6 weeks. Okay, that's the amount of time that the studies typically show that it takes to create angiogenesis, to grow those new blood vessels. So if you can stop taking those painkillers for 6 weeks, you're going to get the best results. Okay, I'm sorry, it is what it is. Okay, another red flag. If you're on antidepressants have been shown to have so many negative side effects on your body. It's terrible. They can decrease testosterone. They can make you feel worse off than you were before, which is interesting. They can increase your rate of suicide, which is also interesting. It can create a chemical imbalance in the brain, which might cause, either a mental cause of your erectile dysfunction or a hormone imbalance, right, which can directly affect your penis. Regardless, even if you do take antidepressants, I'm not going to tell you to stop taking them because I'm not a psychiatrist. If you get shockwave therapy done on your dick, it's still going to grow new blood vessels. It's still going to allow your penis to have the plumbing it needs. So when you can fix either the mental difficulties or the hormone imbalance, you'll have the plumbing that you'll have the plumbing that you need down there to get stronger erections again. Make sense? Another red flag. If you're currently depressed, it's been shown that depression can have a direct effect on erectile dysfunction. So if you're directly depressed, this can still work for you. If you're depressed because you have erectile dysfunction, you need this even more because you're in a downward spiral. You're going to try to get an erection and it doesn't work. You get more depressed and then it doesn't work even more. What we like to tell patients is if you are depressed because you have erectile dysfunction, you're in a downward spiral. If you use shockwave therapy, you're going to go into an upward spiral. You're going to start seeing a small improvement, then a lot more improvement, then more improvement, more improvement. You get more confidence and you're not depressed anymore because your dick works, right? But if you're currently depressed for some other reason, I'm not saying don't use shockwave therapy. You can still get great results with it. But just know that there is a mental, now if you have ED, it's more mental than it is physical, right? Because the shockwave fixes the physical plumbing behind it. But if there's a mental block, you need to deal with that. Another red flag, if you had prostate surgery. I'm going to jump into this at the very end because there's a lot that we've seen as far as success and people that haven't had success with prostate surgery. I'm going to jump into that at the end. Okay, another one. If you're on finasteride, otherwise known as Propecia. Propecia has been shown to cause erectile dysfunction in men. So if you started having ED after you started using Propecia, you should probably stop. Okay. Next, if you take illegal drugs, I'm not even going to go there. Okay. Just stop. If you have ED and you're taking illegal drugs, stop taking those illegal drugs. They might be contributing to erectile dysfunction. Okay. This is the last one. This is also really important. You don't really want to change and you don't listen to your doctor's advice. Okay. There is a motivation behind this. If you have a poor diet and you don't really want to change, you're not going to change and you're still going to have ED. If you have a poor diet and you don't exercise, but you really want to have strong erections again, you're going to follow your doctor's advice and then you're going to see improvements, okay? Do what your doctor says, okay? Read the clinical studies. You might know more than your doctor on a certain type of drug because you've read more of the clinical studies than they have. So definitely read the clinical studies of anything they recommend you. I'm very big on that. On all these episodes, I always include clinical studies in the show notes whenever I make a medical claim, okay? Even right now, in this show note, There's a clinical study that I'm going to be attaching in the show notes on shockwave therapy for patients who went under prostatectomy, got their prostate removed, or underwent prostate surgery, okay? So there is some evidence behind it working for that, and I'm including the clinical evidence, okay? So you should always read the clinical evidence. So those are the red flags. So if you have any one of those or a combination, the more red flags you have, the less of a chance this is going to work for you because you have other factors that are causing your ED that you need to deal with first, okay? If you're super healthy, if you only have one of these red flags or you have no red flags and you're super healthy, this is going to work for you, okay? Now, black flags. If any one of these patients, if patients called us and they had any of these black flags, we would have to turn them away immediately, right? We'd have to say, I'm sorry, this won't help you until you fix that problem first, okay? Sometimes they would beg us to take them in as patients, and we would make them sign a form saying, hey, if you don't follow our recommendations and deal with these black flags, you're probably not going to get results. They didn't care. They wanted to do it anyway, right? And some of them saw improvement, right? It bewildered us. If there's a will, there's a way. But if you have black flags, you really need to take care of this first. So black flags. If you are obese and you have high blood pressure and you have diabetes, if you have all three of those, I'm sorry, that's a black flag. You need to take care of that first, okay? Your life might be in danger as well, so you should probably take care of that first. Another black flag, if you've had a penile implant, I'm sorry, there's not much we can do for you, okay? I have heard some stories of patients who got shockwave therapy done even though they had the implant. There's no real evidence surrounding that. Maybe it works, maybe it doesn't. I haven't seen a clinical study on it yet. There might be one floating out there. But yeah, if you have a penile implant, I don't know what to tell you. I'm sorry. Next one. You've had prostate surgery and they nicked a nerve. And now you can't get an erection even if you take a pill or the injections, the Trimix. So if they nick the nerve down there, how is your brain supposed to send signals to the penis to send blood flow there when you're aroused, right? It can't. There is evidence, which I'm going to jump into in a couple minutes, showing that shockwave therapy can help restore those nerves. So there is evidence, there is hope, okay? But I wouldn't put all your eggs in that basket because it's not conclusive yet. We have had patients who couldn't get erections after their prostate surgery. Then they got shockwave therapy done. Either they used the rocket or they came and saw us in person at Novus, and they started getting erections again. But there are also some people who have had shockwave therapy that had their prostates removed, they nicked the nerve, and haven't seen improvements yet, okay? So just so you know, there is hope. There is evidence pointing towards it does help, but it's not a for sure thing, all right? And then if you currently have cancer in the prostate area, you should treat that first. I don't know what to say. So those are the black flags that we would have to tell patients like, hey, this probably won't work for you. So anyway, as far as... So that's it as far as red flags and black flags go. Again, if you have red flags, please take care of those. You can do it in addition to getting your shockwave treatment because, if it takes you 6 weeks to start cleaning up your diet and start exercising again, that's also the amount of time it takes to start seeing the improvements from shockwave therapy. So not only can you improve the physics behind how your penis works, you can also improve how your body works in general. You can improve your vascular health, improve the blood flow, improve your hormones, right? All at the same time, right? So you're going to get healthier and stronger erections at the same time. If you have those black flags, I don't know what to tell you. There's no real evidence that we can help with shockwave therapy if you do have those black flags. There are stories out there. We've seen patients that have seen improvements, but it's still inconclusive, right? Does that make sense, guys? Sorry to bum you out if you have those black flags. But again, that's why I'm here, to spread the information. Okay, now I'm going to jump into the clinical study regarding shockwave therapy if you've had prostate surgery, okay? So this was published in the International Journal of Impotence Research. Interesting. This was published in 2017. For those of you watching, I'm going to read it out loud for our listeners on the podcast. Low-intensity extracorporeal shockwave therapy for erectile dysfunction after radial prostatectomy, a review of preclinical studies, okay? I'm just going to jump right down into the conclusion because today's episode was technically not just about prostate, but I wanted to include this on here as sort of like a footnote. So here's the conclusion. I'm going to read this out word for word for our podcast listeners. LIESWT, or shockwave therapy, can improve EF, erectile function, in post-RP, post-radial prostatectomy, ED rat models, okay? Angiogenesis and prevention of penile tissue apoptosis induced by the therapy contributed to erectile function recovery to some extent. Although the ability of LIESWT to promote cavernous nerve regeneration lacks direct and consistent evidence, some pro-neurogenic changes, such as Schwann cell activation, release of neurotropic factors, and penile stem or progenitor cell recruitment and activation were observed in penile tissue after shockwave therapy. The results of shockwave therapy for neurological diseases also indirectly support its promotion of nerve regeneration in post-radial prostatectomy erectile dysfunction. In brief, shockwave therapy is a potential treatment of post-radial prostatectomy erectile dysfunction, but many questions should be resolved before its widespread use. Make sense, guys? Thanks for watching. That's the only study for today. We've covered the red flags, the black flags. You should take care of the red flags. Black flags, you might want to take care of as well if you can. And that's it. So tomorrow I'm going to talk about how you can get this amazing therapy for super cheap, that's super affordable in the privacy of your own home. Because as of right now, you can only get it for like $3,000 to $6,000. It costs like $500 a treatment, and you have to go to a clinic. You got to live near a clinic. You got to shell out $500 per treatment until now, because there's a new type of shockwave device out there, which I'll go into tomorrow if you're interested. All right, guys, take care. We'll talk soon.
Are you a guy that wants to upgrade your sexual performance using the newest advances in biotech, but don't want anything with negative side effects? Listen up. If you've been in this space for a while, you've probably heard about low-intensity shockwave therapy, or as the FDA likes to call it, acoustic wave therapy. Over time, your blood vessels down there start to build up with microplaque. This is what drags down your performance over time and is the leading root cause of erectile dysfunction. But acoustic wave therapy has been proven in dozens of clinical trials to safely break up and remove the microplaque with no side effects other than improved blood flow in that area. It can also cause angiogenesis, which means the formation of new blood vessels. So, if you get acoustic wave therapy down there, it can help reverse the effects of aging and help you get more blood flow than ever to that area. Unfortunately, you have to take time off work, take off your pants in front of a nurse, and get this treatment once a week for 6 to 12 weeks. And you have to pay around $500 for every treatment. That's $3,000 to $6,000. Most men couldn't afford this, or didn't live near a clinic, or were even too embarrassed to get treatment. I know this because I helped run the largest shockwave clinic for sexual performance in North America. That's right, we've done more treatments per clinic than anyone else on the continent. But we wanted to help people who either couldn't afford this treatment or didn't live near a clinic like ours. So we teamed up with a brilliant inventor who found a way to turn this revolutionary treatment into a home use device called the Rocket. That's just as effective as the $40,000 devices used in clinics around the world. Now, you can get this life-changing treatment in the privacy of your own home and at a price that's finally affordable for virtually everyone. Just go to getmyrocket.com to learn more. After we made the Rocket, we tested it on a force plate to make sure it had the same energy output as the $40,000 machines used in clinics like ours. It did. Then we tested it on ourselves. Once we knew it worked and was safe with no negative side effects, we ran our own clinical trials on our patients. Every man and their partners saw an improvement in his ability to perform in the bedroom. If you'd like to upgrade your performance in the bedroom, just go to getmyrocket.com to learn more. Forbes has already called the Rocket a multi-billion-dollar industry disrupting device because guys don't need the blue pill after they use it. And biohackers who are looking for that extra edge don't need to pay $3,000 to $6,000 anymore. If you'd like to learn more about this revolutionary device that's now making waves in the medical community, just go to getmyrocket.com. Doctors and urologists are now even prescribing the Rocket to their patients. But you don't need a doctor's permission to upgrade your sex life. Just go to getmyrocket.com to learn more. If you'd like to upgrade your performance safely and effectively with no negative side effects, but don't want to take time off work and drive to a clinic 6 to 12 times and pay $3,000 to $6,000, if you'd like to avoid all that and upgrade your performance in the privacy of your own home, check out the Rocket. Just go to getmyrocket.com. I'll see you there, Rocket Man.